Many Americans, of course, are familiar with OxyContin and how the opioid epidemic has played out here. And if you remember, we were told that OxyContin you could not become addicted to it. Some of these other opioids we were told were safe or were weaker than morphine and some of these other things that had been on the market for some time. In India and in other countries as well, there's a widely available opioid called tramadol, and it is also considered a weaker opioid. But I can tell you that I traveled about 6 hours north of Delhi to a city called Chandigarh, where I went to several de-addiction clinics, and I met many people there who were addicted to tramadol. There are dozens and dozens of de-addiction clinics in that part of India, in part because it sits in the Golden Triangle. So there's quite a number of heroin addicts who live in that area because it's where heroin passes back and forth. But when I did talk to these heroin addicts, they said that they are equal opportunity users. So if they can't get access to heroin, then they'll get access to tramadol. And so even though there's this sense that tramadol is not addictive, that it doesn't carry any risks, in fact, this is just not the case. And you don't really have to go far in many parts of India to find people who are addicted to tramadol. They can easily get access to tramadol. They can either inject it, they can take it orally, and they all said that it was something that was fairly easy to come by. Now, I did go to a number of what are called chemists there in India, all over in Delhi, in Mumbai, in Chandigarh, down in Kerala, in the southern part of the country. And the closer you are to the city and to the government agencies, it is more difficult to get access to some of these medications. Many of these chemists they're professionally run organizations. They really do check to see if somebody has a prescription. But the further out you get, the easier it is to get access to these types of drugs.